My name is Graham Thornicroft, and I'm delighted to mention something today to you about the Lancet Commission on Ending Stigma and Discrimination in Mental Health as a contribution to the King's Health Partners Annual Conference 2022. First slide, please. I'd particularly like to give tribute to my co-chair for this commission, Charlene Sunkel, who leads the Global Mental Health Peer Network based in South Africa. Next slide, please. So you can see this is the work of many hands. Indeed, over 40 people from 20 countries around the world collaborated over the last 2 years to produce this Lancet Commission. What is a commission? It's a long report published by the Lancet on a topic of major international health importance. Next slide, please. What are the aims of this particular report? Firstly, to define what stigma and discrimination mean in the field of mental health. To summarize the many impacts upon people with mental health conditions, to look at the evidence of effectiveness of interventions to reduce stigma, to assess the impact of large-scale programs against stigma, to look particularly at the impacts of the media, and then to make a small number of key recommendations. Next slide. So there was a real focus among the group on the contributions of people with lived experience of mental health conditions. Many of the commissioners are people with such experience. Indeed, most of the commissioners were also from low and middle income countries. You can see altogether about 50 contributors, either among the commissioners or among the members of the advisory board, and the voice of people with lived experience coming through repeatedly in quotations and poems, as we shall see. Next slide. First then, how can we define stigma in relation to mental health? And we defined here 4 types. Self-stigma, where stigma can be internalized. Stigma by association, in effect, stigma against carers, family members, sometimes against healthcare professionals. Public stigma against people with mental health conditions, whether it's problems of knowledge or attitudes or behavior, and problems of structural discrimination, such as historically low levels of investment for mental health care. Next slide. We looked at the whole range of impacts on people with mental health conditions of stigma, and we found widespread evidence that these impacts contravene basic human rights. They have toxic conditions upon access to mental health care and physical health care, including reduced employment prospects and reduced life expectancy. Next slide. As a part of the commission, we carried out new research, which is a global survey of people with mental health conditions. Over 300 people responded from 45 different countries around the world. The large majority said people with mental health problems should be treated on a par with people with physical conditions. That stigma affects most people, 90% of people with such conditions. The media can play a strong role for good or for harm. Governments must invest more. And interestingly, 80% said that stigma can be worse than the mental health condition itself. Next slide. We gathered far too many derogatory terms from colleagues around the world about how people with mental health conditions are referred to, virtually all despicable terms. Next slide. We recommended clearly phrasing which puts the person first, so-called person with a mental health condition, very much like the formula of a person with HIV or AIDS, and importantly, avoiding derogatory terminology. Next slide. We carried out a detailed review of the evidence about interventions against stigma. Indeed, we identified 216 previous systematic reviews, and then we created an overarching synthesis of this evidence. It built up to a single clear message. The most important way to reduce stigma is through social contact. And what does social contact mean? It means contact between people who do or who have had a mental health condition and people who do not. This could be in-person, direct, for example, through a teaching session for police trainees or medical students. But in recent years, also, evidence has been emerging that indirect online digital contact, in fact, can be as effective for stigma reduction. Next slide. Another part of this Lancet Commission report looked at the impact of large-scale programs often national level programs, and you can see here 10 exemplars that we chose around the world, ranging from Liberia to Australia, Nepal to Canada. And we found common ingredients. They need to be long-term, they need to be based upon the principle of social contact. And what this means is that people with mental health conditions are the central active ingredients, the central active agents of change for stigma reduction. Next slide. We had a further section of the report looking at the roles of the media, and we found strong evidence that media can have effects for good or for harm. And we made clear recommendations about the roles of the media. Next slide. We've grouped our few, only 8 recommendations under the following headings. Firstly, for international organizations, that they commit to implement reform of mental health policies, explicitly committing to reducing stigma and discrimination, and that the WHO produces a practical toolkit for countries and for organizations about how to reduce stigma. I'm pleased to tell you that at the launch of our report at the World Health Organization in Geneva a week ago, the WHO accepted these 2 recommendations. Next slide. We also had clear recommendations for governments to repeal legislation which actively discriminates against people with mental health problems, including repealing legislation which criminalizes suicide. There are still 20 countries in the world where suicide is illegal. Next slide. For employers, we had a simple, clear message. A few weeks ago, the World Health Organization published new guidelines on mental health at work, on properly including people at entry to the workplace, on promotion, on pay prospects, and so on, properly including people, again, with parity with others within the workplace. And we support these recommendations in full. Next slide. We have a simple and clear recommendation for people working in health and social care sectors, which is to pay attention to the trainees, to the young people coming through the system. We recommend that all trainees in health and social care sectors in all countries worldwide undergo training of anti-stigma interventions, evidence-based, social contact-based anti-stigma interventions. Next slide. With respect to the media, there is a lot to do, and we call upon all national and international media organizations to issue policy statements and action plans on how they plan to promote mental health and how they plan to actively contribute towards the reduction of stigma and discrimination. Next slide. In relation to people with lived experience and also local communities and civil society, we recommend that anti-stigma initiatives, whether they be local or national or indeed international, are either led or co-led by people with mental health conditions. We also recommend that governments put in place funded programs to support people with mental health conditions in various ways, including peer support networks, providers, jobs as providers of mental health care, paid jobs such as peer support workers, and also systems to support people who have mental health conditions and who are finding it difficult to know about whether to conceal or disclose that, for example, in job applications. Next slide. To summarize this report as a whole, we issue this call to action. Mental health is part of being human. Let's act now to stop stigma and start inclusion. If you would like any, next slide please, if you'd like any further information, then please do contact me here at my KCL email address, and I'd be happy to send further material or discuss the report and its implications. Thank you very much for your attention today, and my very best wishes for a successful KHP Annual Conference 2022. Thank you.